Hi, I'm Dr Timothy Shim. Today, I want to share with you 4 tips on how to recover quickly following a tummy tuck or an abdominoplasty procedure. So what is a tummy tuck procedure? In a tummy tuck procedure, loose and excessive skin is removed from the lower part of the tummy, and on top of that, the six-pack muscle that is usually separated following pregnancy will also be reapproximated to the midline. Come, let us begin. First things first, we want you to move early. The very next day after surgery, we may want you to rest in bed because you may be feeling tired and we do not want to exert excessive tension on the surgery wound. However, 2 days after the surgery, we would like you to get out of bed to sit on a chair and, if possible, to also begin walking. Moving about and keeping active and walking improves blood circulation to prevent deep vein thrombosis. Also makes you feel better with the release of endorphins that you can regain a sense of normalcy from an early period. In addition, ambulating early also helps with bowel movement to prevent constipation. So keep moving after surgery and follow the instructions of your surgeons closely. Secondly, you should also avoid applying excessive tension on the surgery wound. This may mean that you cannot lie flat on your tummy following surgery, or also to avoid carrying heavy weights that will put excessive strain on the surgical wound itself. Remember, good care of the surgical wound in the early post-operative period would mean timely healing, and timely healing will also mean a better scar. Thirdly, you should keep the abdominal surgical wound clean and dry. Keeping it clean and dry would make sure that the wound heals properly without any infection, as infection would then result in delayed healing. Specialized dressing is usually applied onto the wound itself, and these may or may not be waterproof. If waterproof dressing is applied, then you may be allowed to shower. So please check with your surgeon what you can do and what you cannot do. Last but not least, you should wear the abdominal binder prescribed to you diligently. Remember, during the surgical procedure, the six-pack muscles were reapproximated to the midline. Although the external wound on the skin just takes about 14 days to heal, this internal wound may take up to 3 months. And during this period of recovery, the abdominal binder gives you the essential support that you need for the core muscles of your abdomen. So please adhere to wearing this abdominal binder diligently. That's all for today's video on the tips for good recovery following a tummy tuck procedure or abdominoplasty. Good recovery does take some patience and strict adherence to the post-operative care required for the abdominal wound. If you do have any queries or concerns, don't hesitate to approach your surgeon for further advice. And after all, we all are working together to make sure that you get good results. Do like this video or subscribe to our channel for more information on aesthetic procedures. Till next time, goodbye.